Hello, my name is Jacob Ruff, and I will be presenting you with diabetes and exercise and how they relate to each other. We'll start by getting a general overview of what diabetes is, what exercise is, and then towards the end, we will get into how they relate to each other. To start, there are three main types of diabetes. You have diabetes type 1, diabetes type 2, and gestational diabetes. All forms of these diabetes relate in some way to your body's insulin and how they work with your cells. And insulin is a hormone the body needs to transport glucose from the blood into the cells of the body. And currently, there are over 122 million Americans that are either currently living with diabetes itself as diagnosed or are pre-diabetic, in which they are going to have diabetes unless they make a change soon. Diabetes type 1. This type of diabetes is usually present in children, teens, and young adults. And in this form of diabetes, the pancreas isn't making any insulin, or it's making very little insulin, which thus causes there to be high levels of glucose in the blood, which damages the bodies, causing the symptoms that you see in diabetes type 1. Type 1 isn't as common as type 2. In diabetes type 2, this form of diabetes is the most common in people over the age of 45. In this form of diabetes, cells become insulin resistant, meaning the cells of the body aren't responding to the insulin that is being provided to them. And as a response of this, the pancreas continues to make more insulin to get the cells to respond before the pancreas can no longer keep up. And this is because the pancreas is producing so much just to get the cells to respond to the insulin to take up the glucose that the pancreas eventually loses the ability to produce that much at a efficient manner. When this happens, blood sugar rises as a result of not making enough insulin, and damage begins to be done to the body. This can cause other health concerns such as heart disease, vision loss, and kidney disease. Gestational diabetes. This form of diabetes develops during pregnancy in those who didn't previously have diabetes diagnosed. It is caused by the body's inability to make enough insulin during pregnancy, which is a result of the changes caused by pregnancy, such as increased hormones, increased weight gain, which cause cells to use insulin less effectively, and this is known as insulin resistance. There aren't typically symptoms associated with gestational diabetes, but it can complicate pregnancy via high blood pressure, risk of a large baby, early birth, baby with low blood sugar, and a high risk of that baby getting type 2 diabetes later in their life. What is exercise by definition? Exercise is physical activity that is planned, structured, and repeated with the goal of conditioning part or parts of the body to improve overall health. The physical activity recommendation via ACSM is 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week at a minimum of 10 minutes per session. It's a minimum of 10 minutes per session because 10 minutes is the bottom line where you begin to see positive health effects from that exercise session. Moderate intensity exercise can be as simple as a brisk walk on a flat surface. Vigorous intensity can be as simple as a jog, a run, or a brisk walk at an elevation such as a hill. And there are many types of variations of both moderate and vigorous intensity exercise, which can be found online. The effects of exercise on diabetes is immense. There are a lot of effects, and it is almost impossible to list all of them in one presentation without flooding these PowerPoint slides. A general overview on these effects are increased physical activity makes your body more sensitive to insulin and helps control blood sugar levels, which helps combat the insulin resistance we mentioned previously as a effect of the diabetes. This can also lower the risk for heart disease and nerve damage due to diabetes. Many added benefits, and this is just a brief list. There are many more possibilities of benefits of exercise depending on your current health status, but exercise helps you maintain a healthy weight, helps you lose weight, helps improve your mood, improves sleep, improves memory, helps control blood pressure, and it lowers bad cholesterol, known as LDL, and raises good cholesterol, known as HDL. Now, there is many research relating to exercise and diabetes and how they coincide with each other, how being sedentary may cause diabetes, and how being physically active in general can help either reduce the risk of becoming diabetic, or it can reduce the risks currently associated with diagnosed diabetes. Type 2 diabetes is associated with decreased levels of physical activity and increased prevalence of obesity. Type 2, although very common, is one of the forms that are actually more avoidable depending on health status. And although this is true, all types of diabetes can benefit from the effects of physical activity, even though type 2 may be more susceptible. Type 1, type 2, and gestational all can receive positive health effects of exercise via research. Exercise can improve the metabolic abnormalities associated with diabetes, and although exercise is the highest priority in type 2 patients, as I mentioned before, people with type 1, the priority is usually about adjusting the therapeutic regimen just because of the specifications and the causes of type 1 that aren't necessarily associated or shared amongst type 2 diabetes. Continued with exercise and diabetic research and how they coincide with each other, recommendations associated with each form of diabetes and how much you should be exercising and what type of exercises will be mentioned here. Adoption and adherence of physical activity is critical for blood glucose management and health in those with diabetes and those pre-diabetic. Specific physical activity recommendations vary between diabetes types, whether you're type 2, type 1, or gestational. The recommendation for type 2 is daily exercise, both aerobic and resistance, to achieve 150 minutes per week. And this relates to each session needing to be at least 10 minutes to see health benefits from that specific session. So no matter what way you slice it, as long as you get 150 minutes through the week at a minimum of 10 minutes per session, you should be good. But you do not want to go 2 consecutive days without physical activity, and that's mentioned here at gestational, but it applies to all types of diabetes. The recommendation for type 1 is 60 minutes a day of moderate or vigorous intensity cardio, muscular, and bone strengthening exercise. The recommendation for gestational diabetes is 20 to 30 minutes moderate intensity exercise most days of the week, avoiding 2 consecutive days without physical activity. And this can be aerobic and or resistance training. Research supports the significant amount of benefits from exercise when you are diabetic or pre-diabetic, or any stage of your life for that matter. And this is only a brief overview of the benefits when you do have diabetes. The benefits of exercise in type 2 diabetics: it enhances insulin action, promotes weight loss, and improves glycemic outcomes and other health outcomes associated with diabetes. The benefits of exercise in type 1 diabetes: blood glucose response depending on type and timing of the exercise, whether that's extensive amounts of time, whether that's aerobic or anaerobic, but they all improve glycemic balance. The benefits of exercise in gestational diabetes: improved cardiovascular health, fitness, and reduced risk of pregnancy complications such as preeclampsia and C-section deliveries. Here we arrive at a summary or general conclusion to diabetes, exercise, and how they overall relate to each other. Regardless of the type of diabetes, or if you're pre-diabetic, age, current health status, exercise can and will provide extensive health benefits to you. The amount or type of benefits varies amongst these variables that I just mentioned. The workload varies amongst current diagnosis, whether you're type 1, type 2, or gestational. The type of exercise, whether that's aerobic, strength, resistance, varies amongst the type of diagnosis you have. But at the end of the day, you want to make sure you are medically cleared with a doctor before participating in any given exercise or exercise program to ensure your overall safety. Here are my references. If you'd like to check them out yourself, they provide extensive research and much more knowledge than I would have been able to fit in this presentation. My name is Jacob Ruff, and I appreciate you tuning in and listening to my presentation. Thank you, and have a great day.